We have Dr. Nick van der Heyden. Dr. Nick, he is the Incrementalist. He's a digital health leader and a gentleman I've known for years with wonderful insights into the whole health tech industry. So, Nick, smart medicine. Are you implying that it wasn't smart to begin with?
I am. It's funny you should say that. I actually think that there's a quote from, I forget the individual that talks to that said that, medicine used to be pretty unsophisticated, but, for the most part, um, uh, dangerous because of some of the things that we did. And now we've moved to all of this assessment, and now we're seeing essentially much more in the way of challenges as a result of that, but also increased safety. So um, uh, we'll talk a little bit about that as part of this presentation. Thanks for having me. My name's Nick van der Heyden. Everybody calls me Dr. Nick. I'm an emergency room physician by training, digital health leader. I've spent my time at this intersection point between healthcare, technology, innovation. I love this stuff. I'm truly fascinated by it, and I hope to take you on a little bit of a journey as to how all of this has developed and what it means for your future in healthcare with the application of this new intelligence. So let me start with a few definitions. And to be clear, I don't expect you to read this slide. I really sort of present this as a point of information. People talk about AI. I did learn something new just now, that KI is the German instance of that. Didn't know that. But we reference this, and it really applies to many, many technologies. And as my brother said some considerable period of time ago, this is not new technology. We've been using elements of this. We've just progressed in terms of the capabilities beyond what actually happens. And I'm going to tease out some of the exciting areas that this will bring to our world of healthcare specifically, and already is in many other areas. So where did we start? For those of you that are history buffs might remember back in the 70s, a rule-based expert system that was called MySyn. I did wonder about the naming. That's actually in part because they picked the end of most of the antibiotics that we used in those days, and they tend to end in MySyn, and that was why they called it MySyn. It was an algorithm. It did have some elements of data, the application of rules, the inputs of information. I want to say it was about 450 or so rules that guided people to selecting the appropriate antibiotic for treatment. Relatively successful, very early days. We have moved light years beyond that at this point. And what we're seeing now is much more in the way of operational efficiencies. I would define this as the low-hanging fruit. We can improve clinical documentation and coding. We can essentially organize your life. Those of you that use MapQuest, or not MapQuest, I'm dating myself by even naming that, because I'm not even sure that still exists, but Google Maps, Waze, your preference will come up with reminders to say, hey, I see the traffic to your appointment is actually building. You should leave a little bit earlier. All of this is some of these technologies, this AI that I'm going to use as a general term. And we see that in healthcare. We can actually start to automate the appointments, send out reminders. We can actually schedule staff in ways that make it much more efficient from a workflow standpoint, optimizing for the number of patients that we have, the workflow. In the US, obviously, from a claim standpoint and payment, we have all the automation that potentially takes place with claims management. And we have a nuclear arms race that's going on in that space, where you have payers with AI and the hospitals and the systems and the physicians with solutions that are essentially